Just a second, because now I have a whole pop-up in front of the screen here. Okay, now I'm ready. So good afternoon, everyone. My name is Sarah Dugan. I'm a mental health pharmacist and faculty here at Northeast Ohio Medical University, and I'm doing our didactic today on the 2023 Surgeon General's Advisory about social connection. From an objective standpoint, the only thing I'm going to do is talk about the Surgeon General's Advisory. So all of the information, that is the only reference that I'm using, and that's where the information is coming from. This is the Surgeon General's Advisory. As I mentioned, it was published last year. It's available at the hyperlink that's listed there. If you just Google it, it will pop right up, and it's freely available pretty much for everyone. I had selected this one. There have been a number of different platforms and meetings that I've been in where this has been discussed. And I just wanted to bring it forward. I'm not sure that everyone has seen it, and it does have some relevance, especially in the integrated care space. And we'll take a quick closer look at that as we move forward. So there's an overview to this document. There are, I believe, 4 different chapters, and then there's a series of appendices and additional supplemental content at the end. The whole document's about 83 pages long. Just for the purpose of transparency, I included information from the overview, which is the justification, from the second chapter, which really focuses on social connections link to a number of medical conditions, including some mental health conditions. And then I also included information from the 4th chapter, which was focused on the national strategy for what to do about this social connectedness epidemic is what he calls it. So I didn't include chapter 3. Chapter 3 was focused more on the communities, and just for sake of time, I did leave that out. Before we get started, I always like to start with definitions. Since this is the Surgeon General's Advisory, just a quick definition, and I pulled this verbatim from the PDF document. So Surgeon Generals are able to put out a number of advisories on different topics, and the advisory itself is designed to be a public statement that calls the American people's attention to an urgent public health issue, and it provides recommendations on how this should be addressed. So it could be on any potential topic, but something that's related to public health that's deemed to be important and that requires additional attention. It is reserved for those significant public health challenges, and the goal really is to increase awareness and to try to stimulate a number of different parties into action. As we look at what the national strategy is going to be, there were 6 pillars that were identified. You'll see that really reaches in a number of different locations outside of just public health or the healthcare sector in general. In the Surgeon General's letter at the very beginning of this advisory, it talks about how he had gone on a listening tour. And as part of the listening tour, post-COVID, what he continued to hear about was this sense of isolation or sense of loneliness. And he mentions that there were a number of individuals who would describe it, but couldn't really put a term to it. They weren't able to name it as they felt socially isolated or lonely, but it came up so frequently that he activated a work group to do a pretty extensive literature review to look at the information related to this and to start developing what those pillars of the national strategy were going to be in response. Now, social connection. What is it, and why does it matter? Why was this something that even popped up on his radar? Social connection hits all aspects of our life. So from family, the neighborhood that we live in, our workplace, our friends, it could be in educational settings, it may be in any type of setting that you're in, the organizations that you belong to. If you have a religious affiliation, it includes that. And why the social connection is so important it's considered to be one of the fundamental human needs. So we often think of shelter, water, food as being some of the primary fundamental needs, but social connection is up there as well. Historically, social connection is seen as one of the main reasons why the human species was able to evolve and survive way back. At that time, if individuals hadn't come together to rely on one another, there were much larger entities that were out there that were a direct threat to them. It would have been very difficult for them to be able to provide safety, to have a shelter, to take care of any younger children that were running around. So it really required individuals to work together as a group. And that social connection is thought to be somewhat genetic, and that it's continued, despite the fact that we live in a situation where we don't have imminent threats hunting us on a regular basis, that food and shelter are a little bit more predominantly available, but that potential need still exists. And without it, they're recognizing that there are impacts to health, both in individuals' healthcare as well as public health issues. It seems to play a role in community safety. I will only hit on this briefly. As I mentioned, this was the one chapter that I did neglect to include just for sake of time. The social connection has been associated with both resilience and prosperity. Prosperity including academic performance and accomplishments, as well as further training and essentially financial status, so workplace satisfaction and job achievement later on. Now, recognizing that social connection is relatively important, it's going to be the focus of what we talk about today, I did want to provide some additional context. Well, I was thinking, okay, social context, it includes family and friends and all the places and things that you do. It was hard to be more discrete and objective. So they did break it down in a couple of different ways. So they talked about components, so vital components of social connection, being the structure of the social connection, the number of different relationships folks have, the variety of different relationships. Often they'll call this social roles. I will use myself as an example. So I am a daughter, I'm a sister, I'm an aunt, I'm a mom, I'm a wife, I'm a pharmacist, I'm a professor, as well as a friend. So I fulfill a number of different categories, and sometimes it's hard to remove one hat and put it down and put a different hat on. But looking at the number of those, I think there's been a big focus recently to try to streamline that for some folks. And this actually is going to challenge that just a little bit, and suggest that having at least a few different roles may be really beneficial for that social connection. So they're talking about the number and the variety of those relationships. The frequency of interaction, so how often are you engaged with some of these relationships? Again, I'll use myself as an example. So for some of the, so I am Catholic, we go to Mass pretty much every week, except when we end up with a dance competition or a baseball game that falls on a Sunday. So that would be one where we have weekly interaction. I have other professional organizational memberships where I'm a committee member for the Ohio Pharmacists Association, and one of those committees we meet twice a year. So that would be, from a frequency perspective, that would be biannually. It's what's required of that. There are very discrete charges that we need to take care of for the Member Services Committee. So looking at both of them, there's not a right number, but recognizing that there is that fluctuation, it's important to take a peek at that. If the biannual frequency was with how often we go to Mass, that may impact how successful or how rewarding that particular relationship is. The next component they looked at was function. So the degree that those relationships meet different needs. Again, there's not an established gold standard that, you're supposed to have this many relationships and it's absolutely going to meet all of these. There are some folks that have different needs, and their needs are going to change over time, especially through the lifetime. So recognizing that some of the relationships may be really beneficial, potentially for elementary school children, there's a lot, a large number of relationships. They're on a chronic basis, but they really support the social connection at school. Whereas as individuals get older, they go to high school, maybe they go on to college, or they take a position after high school, those numbers may dwindle, but as long as they continue to fulfill the need of that social connection that individual person has. There's also a fluctuation. So there may be some folks that are your ongoing people. I refer to them as your people. So these are folks that you're in contact with on a regular basis, likely family, close friends. And then there may be others where it's situational. My son plays 3 sports, and he plays soccer, he plays basketball, he plays baseball. There's a different set of parents for each of the sports. There's nobody else currently that does all 3. So we have a shifting group of parents. So those would be folks that you see, but it may be very seasonally dependent with where you are at that point. And then you may have the folks that really pop up in the emergency situations. So maybe that's more of the healthcare providers. Maybe that's additional neighbors that step in when you have an additional need. So really looking at the function of some of those relationships. And then the quality. So both the positive and the negative aspects of the relationships and interactions. The goal would be that things like family interactions would be positive and really assist with social connection, but that's not true for everyone. In some cases, the more frequent those family connections and interactions, potentially maybe we're seeing more negative aspects. So altering that frequency would be necessary. So all of that is going to be part of the social connection discussion we're going to have. The other thing that they did with the social connection was they had 2 discrete variables. So one is social isolation, the other was loneliness. So social isolation is a little bit more of the quantitative data, so the objective data. So it's the number of social interactions, social relationships, the roles that you play, the memberships you have, and the frequency of those interactions. So that's much more objective. Whereas loneliness encompasses the subjective piece. So it was defined as the subjective internal state of perceived isolation, or a mismatch in what the person perceives that they need and what they're actually getting. So they may have, they may feel that they have a greater need than what it is that they're getting, even if the frequency is the same. Again, I'll use myself as an example. When I had my son, he's now 17, but when he was a newborn, we lived 2 hours away from my family, my parents, 2 hours away from my in-laws, and they all came in on a regular basis. We saw one set of parents or the other about once a month, which was actually more frequently than what we had been seeing. But I will tell you, in those first couple months, that did not feel like enough. I really felt like we could have used some additional hands-on assistance within that time frame as we were trying to get our feet on the ground. So that was, even though technically we had an increased frequency, I felt very alone or isolated because it wasn't as frequently as I felt like I needed. So this whole advisory really encompasses both of those. Again, why is it important? There was a study that was done by the adults in the United States, and they found that only 39% felt that they were socially connected, that they really did not have pretty significant social isolation or loneliness. So that means there was about 61% that did not feel like they were adequately socially connected. So a relatively robust number who feels like they fall into that category. So looking a little farther, they feel like they fall into that category. Are we actually spending more time alone? The answer is absolutely yes. Yes, we are. Over time, there has been reported increases in social isolation from everyone that has been increasing over decades. This was a study that was done at 3 different timeframes. So reported on 3 different timeframes, 2003, 2019, and then 2020. So it was repeated in 2019, and then as a result of the COVID pandemic, they did want to repeat it. They were looking at the number of minutes that adults in the United States report spending time alone, and then they translated that into the number of hours per month. In 2003, the average was about 285 minutes per day individuals were alone. That increased. In 2019, it was 309 minutes a day, and by 2020, it was about 333 minutes a day. In looking at the hours per month, it increased from 142.5 hours per month spent alone to 166.5 hours spent alone. So essentially a whole day was gained in time just alone, not interacting with other individuals. Time with friends went down significantly from an average of 60 minutes a day to just 20 minutes a day from 2003 to 2020. And the greatest decrease that they saw was in young adults. So those in the age group of 15 to 24 years old. So quantitatively, yes, people feel like they're not connected, and the amount of time they're spending alone would suggest that that is what's happening. Now, they're not the only one. So there are a number of different factors that can shape social connection. I'm going to go through, this is a graphic that was in the advisory, and I wanted to go through each of the 4 layers. So there are individual factors. There may be reasons why folks are not able to interact with other folks. So if they have chronic diseases, things that potentially limit them from being able to get around and interact with other folks. Gender plays a role in the likelihood that individuals want to be socially connected, the stage of life that you're in. I'll be honest, we were, so my son and my daughter are 16 months apart. When Hannah came home, because she's the youngest, having those 2 that little, yeah, we were just trying to get by from a day-to-day basis. We were not doing anything social. We were just trying to survive. So there will be phases of life where that social connectedness is going to shift a little bit. Mental health can play a role, individuals' personality. So the number of folks who may really lean into being introverted and not wanting to have a lot of social connections. Race can play a role if there are any sensory or functional impairments, as well as their socioeconomic status. It's suggested that lower socioeconomic status actually is associated with fewer social connections. So that may potentially be a limiting factor. So what else plays a role in social connections? Relationships, so the types of relationships, the way others behave, the characteristics of others that you're surrounding yourself with, the function of the relationships that you're looking for, the household size. So if it's a relatively large household, that may shift what's expected of some of the relationships, the quality of those relationships. If there's a smaller number, but they're very high quality, that may shift how much people are looking for additional outside connections. And the structure. So what do things look like? One of the examples that could be used here is an individual who works 3rd shift. So if they're working in the overnight to early morning hours and then sleeping during the day, it may be difficult for them to be able to socialize with other folks, family and friends, just because their schedules really don't align. It also could be said for folks who travel a lot for work that technology has assisted, but not quite the same as in-person interactions. Community is the next layer that they say can shape social connection. So where is it that you're located? What community organizations, what type of religious organizations are available? Does that meet some of your interests or your needs? Healthcare availability, housing, if you live out in rural areas. So I am currently sitting in Ritztown, Ohio. There are some neighborhoods, but there's quite a bit of open space. So there are folks who may not necessarily have neighbors because they can't even see some of the houses that are next to them, or they may be separated by acres. What type of local businesses? Are there government type programs and initiatives in place to have a lot of social connection? I'm again and I'm only using myself as an example because I think it's helpful for context. So Kent tends to have a lot of activities that happen in downtown. They really try to draw people into downtown. So they'll have a number of different festivals. They have several different live music festivals that will open up. So the entire downtown has a couple times during the year, they'll have bands that are playing at pretty much every place that they could potentially play at. They do it with Beatles themed band. They have a blues one. They have one that's just whatever bands are coming to play. So they really do try to, and they advertise it everywhere to try to draw individuals into the downtown area. Is there adequate outdoor space for people to gather? What do the school systems look like, and what is it that they're offering? Is there transportation for folks to get around, especially if something's relatively spread out? Is it easy for folks to get in, that they can park, that they can walk to some of the areas where other things are happening? And community can also be your workplace, so the folks that you interact with in your occupational life. The last piece in terms of shaping social connection is society. So what are the societal expectations? This one I'm going to try to stay away from a little bit, just because I think there are people who feel very strongly on both sides, and the polarization of our current country was definitely highlighted here. So are there differing degrees of civic engagement? What are some of the democratic norms, historical inequities, the values of the particular area that you're in, some of the public policies, and then the technological environment and use. So do you have cell phone service? Would you have service regardless of where you are, so you'd be able to be in touch with a lot of other individuals? And that can really help shape a number of those other layers. It likely has a very direct impact on each of the layers underneath. So recognizing that all of those layers play a role in social connection, why is it such a big deal? Well, it's been associated with increased mortality. So lacking social connection actually has an odds ratio of increased mortality that's about 0.65. That surprised me a little bit. I was not expecting that. That's higher mortality odds ratio than individuals who smoke, a little less than a pack a day. It's higher than those who drink 6 alcoholic drinks daily. It's higher than those who are physically inactive. It's higher than those who have obesity, as well as those who live in areas of high air pollution. So it has been identified as an independent risk factor for increased mortality in individuals. It also has been associated with premature, so these are 3 different categories. So premature death is our blue bar. So those who don't have a strong social connection have an increased risk. And I use the more conservative numbers of 26%. There were some cohorts that estimated it could be up to 50% increase in premature mortality, depending on the patient population you're looking at. Those who had poor social connection were much more likely to have cardiovascular disease, so almost 30% more likely, and they were about 32% more likely to have strokes than individuals who were matched for age, sex, comorbid conditions, but had stronger social connections. So it really appears to have a pretty significant impact on an individual's potential health. I wanted to do a little bit of a deeper dive in some of those conditions. And chapter 2 goes into all of this detail. So if you want more detail than what I was able to include here, please feel free to look at that. So they looked at patients who, they looked at hypertension. They looked at cohorts who would be considered high risk. They specifically looked at African-American patients. And they were looking at the risk for developing hypertension in a couple different cohorts. And they found that individuals who did have strong social connections, so they felt like they were very socially connected, had a decreased risk of 36% for developing hypertension, even in a high-risk group. So they were less likely to develop this potentially chronic medical condition. When they looked at heart failure patients, these patients pretty significantly reported loneliness and social isolation. Some of it may be a result of some of their physical limitations, but when they compared folks in terms of their cardiac status, they found that even though they had the same cardiac status, if they had poor social connection, they were 55% more likely to be rehospitalized. If they endorsed loneliness, a high degree of loneliness, they were 68% more likely to be hospitalized, 57% more likely to need to go to the emergency department, and 26% more likely to have to require additional outpatient visits. So again, cardiac status being the same, that social connection did appear to be associated with an increased burden of that disease. It went beyond cardiovascular disease. So they found associations with diabetes. So poor social connection has been associated with increased risk of diabetes, both in men and in women. In men, poor structural social support, and if they live alone, appeared to increase their risk for being diagnosed with diabetes. And for women, if they had perceived decreased emotional support, and if they lived alone by the age of 70, they also were more likely to be diagnosed with diabetes. They also looked at type 1 and type 2 diabetes, and they found that folks who had greater social support, especially family support, were more likely to meet their treatment goals. So these patients were much more likely to be successful and to not have micro or macrovascular complications from their disease. The onset of those complications was much longer in the patients with stronger social supports. So they were more likely to have diabetes, and it was less likely to be controlled if they had poor social connections. They found some associations with infectious disease. So folks who had fewer social connections appeared to be more susceptible to infectious diseases, and they appeared to have a lower immune response. So there were a couple different cohorts that they included in their description. So in one of them, they had folks who were exposed to a virus. So they knew that they were exposed to a common cold virus. Those that had more than 6 social roles and felt socially connected had a 4-fold lower infection rate than those who were equally exposed, but did not have that same degree of social connectedness. Now, they didn't say if there were other factors that were involved, but they did say that their other medical conditions were the same. So it did appear that that had an impact on the immune system. They also looked at folks in their response to the COVID-19 vaccine, and they found that folks who had lower social connections actually had lower antibody levels. They were more likely to have lower antibody levels than their counterparts who were more socially connected. Cognitive function, there's some pretty compelling data related to cognitive functioning. Those who had decreased social supports and endorsed loneliness had a 20% faster decline in their cognitive abilities than those of the same severity at baseline who weren't followed over time. So that was over the course of about 7.5 years that they followed them. So if they were more socially connected, they did not have as quick of a cognitive decline. And as you would expect, in seeing that decrease in cognitive abilities, the risk for dementia did go up. So in one cohort, they found that the risk for dementia was 50% higher in those that had decreased social connections. So this really appears to be an opportunity for that patient population to get them socially connected. to potentially delay the cognitive decline and maybe decrease the prevalence of dementia. Mental health, so they see increases with both depression and anxiety. They did recognize that this appears to go in both directions. So social isolation may be a result of the symptoms of anxiety and depression, but they also see it as a precipitating risk factor for the development of anxiety and depression conditions. It also has been related to suicidality. So social isolation has been identified as one of the strong, reliable predictors for suicidal thoughts, suicide attempts, and suicide completion, as well as self-harm. So this does appear to be one of the target areas for some of the zero suicide initiatives. Now, why does this happen? It seems like those are a lot of different types of conditions. They proposed 3 different reasons for how social connection may impact those medical conditions. So the first is behavior. It suggested that individuals with greater social connection have engage in healthier behaviors. So they're much more likely to be paying attention to nutrition, to be a little bit more physically active, as well as being more adherent to treatments that they're involved with. So this may decrease the prevalence of a number of chronic diseases, including the hypertension that we saw. Biologically, it suggested that social connection can play a role in stress hormones and inflammation. This appears to be where a lot of the focus is. If there's a lot of social connection, they tend to see lower stress hormone levels and lower inflammatory markers. They also suggest that this can be beneficial with gene expression. So really protecting or activating some of the more protective genes that we have, and it may enhance the immune function, as we saw with the infectious disease on the last slide. They also see dysregulation with some of the cardiovascular and neuroendocrine systems. So in addition to having inflammatory markers, the body may be a little bit more sensitive to them than what you would expect. And it's thought that this may be linked to the psychology piece. So increased social connectedness has been associated broadly with more folks endorsing having a sense of meaning or purpose. And when they have a sense of meaning or purpose, it appears to help increase their motivation and engagement in healthier behaviors. It also appears to reduce some of those inflammatory markers, and it changes their perception of stress. So if you have 2 individuals, one who's socially connected and feels a sense of meaning and purpose, and one that is not socially connected, and they're exposed to the same stressor, the perceived stress and challenge of that is drastically different between the 2, with the individual having those strong social supports, maybe seeing it as a challenge or it's something that they need to work at, and it's almost a game, almost something that they need to overcome because now it's going to be something they can celebrate, as opposed to being something that's perceived as being very difficult to overcome, an incredible obstacle, and something that really is helping to hold them back. So they do see all 3 of these potentially playing a role in how social connection translates to changes in the medical conditions that folks have. So in seeing all of that and the fact that social connection could potentially play a role in medical care, there were a number of different pillars that were identified. I'm going to focus on the mobilized healthcare, but I did want to present them all. So the first recommended strategy was to strengthen the social infrastructure. Easy for me to say, apparently not. So they suggested that looking at the built environment, so what are the things that are there? Are there places in the community where folks can gather? Is it encouraged that people are getting together? Is there a way to establish different connection programs or really support folks being able to get out and interact? Enacting pro-connection public policies. So the suggestion is to make sure that there's an appreciation for trying to support the social connectedness in all of the policies, and to have cross-departmental leadership. So mimicking and role modeling what that social connection could look like in government, so that hopefully it will be implemented farther down the line. Reforming digital environments. There was a love-hate relationship with social media. So yes, technology can help with the number of connections, but it's been suggested that the amount of time someone spends on social media is directly related to the amount of loneliness that they experience. The threshold that they had identified was 2 hours. Individuals who spent at least 2 hours or more on social media were less likely to feel socially connected. They were more likely to report loneliness. They were more likely to report decreased self-esteem. And that was compared to folks who spent less than 2 hours on social media. So really looking at that, encouraging data transparency from those companies, trying to support the safety standards that are in place, and to try to capitalize on some of those pro-connection experiences. So advocacy or support groups, yep, that's amazing that they can do it online, but is there a way to also use that to build a meeting or a get-together that happens regionally or in a particular area to try to help really build upon that experience? Deepening our knowledge, they want to increase funding as well as research projects in this area to increase what we know about it and how best to help establish those social connections, as well as to increase public awareness in general. And then to build a culture of connection. I think this one's going to be pretty difficult. The first one is to cultivate values of kindness, respect, service, and commitment. So really trying to go back to having people want to interact and to interact appropriately with each other. They again call for modeling those values within the leadership of all areas of the community, and expanding the conversation, making sure that these conversations are popping up in religious organizations and professional organizations and local government and schools and all of these other places. The place you're most likely to see some of these interventions is mobilization of the health sector. So they really want to make sure this information gets out to healthcare professionals so that we're aware of the potential impact of the social connections. And I don't know if you remember, but Doug Smith had done a presentation in the past about social prescriptions, and it was specifically addressing something like this. So getting folks set up with experiences that help them build a network and social connections to address some of the conditions that they were experiencing. Assessment and support of patients, so being able to recognize folks that might be at high risk for not being very socially connected, or encouraging and educating them to pay attention, and expanding some of our prevention and public health initiatives. So really trying to target different populations to get them together to start establishing some of those social connections in areas that they might be interested in. So public health awareness campaigns can go to any of the interest groups or potentially individuals who are, animal advocates, or those who like to garden, or any of the interest areas that they like, and really trying to help tie some of those pieces in, whether it be education, vaccine awareness, screenings, adherence, meeting with other healthcare professionals, things like dietitians or exercise scientists, but really helping to target some of those other areas and maybe establish additional social connections to improve care overall. So in summary, social connection is a vital component of human existence, but it's shaped by a number of different factors. Diminishing social connection often is a result of social isolation, loneliness, or a combination of both. And it has pretty significant ramifications, especially on the medical side. But there's also an economic side as a result of lost productivity, absenteeism. It's estimated that $6.7 billion in Medicare money So Medicare patients, older patients, $6.7 billion was spent in a number of direct and indirect costs that can be tied back to things that are worsened by the lack of social connection. So lots of areas for improvement. So that's what I got on the Surgeon General's advisory.